Good evening to all the aspirants present here. Good evening, Dr. Anand Joshi, sir.
Good evening, Fatima.
Yes, sir. So you can share your PPT. We'll be starting, and many more aspirants will be joining us.
Right. Thank you.
So, aspirants, today's topic is genito-urinary medicine and AIDS, and the speaker that we have here is Dr. Anand Joshi, sir, who is a consultant, intensivist, and physician at Gamman Hospital, Hyderabad. So, you may take over. Thank you.
Good evening to all, and welcome to another session of a series of talks for your preparation for MRCP preparatory course for part one and part two. Um, Today's topic is genito-urinary infections, which is very common and commonly called as a sexually transmitted disease. And this topic you will encounter more so in history taking when you're doing at your PACES course. And there will be a couple of few questions you would come across in your theory part also. Important are the infection specific, which are namely gonorrhea, chlamydia, syphilis, which I will be covering in today's session. HIV and AIDS is a very vast topic and will be covered in tomorrow's session. One of the important things when you are dealing with sexually transmitted disease, especially from the exam point of view, you will be required to acquire an history taking examination and its investigations that needs to be explained to the patient, and you may get a table or a station for the same. um, Here the importance is given to how accurately you're taking the history, and the key components where you get marked are in a history taking. What are the examination features specific to that disease you are having a differential, and what are the relevant investigation you will be sending. It is very important as a general practitioner or as a part of the MRCP that certain specific thing about the investigations you are aware. Now, because this is quite a sensitive issue, building a rapport with the patient becomes very important. You have to ensure in your discussion the confidentiality, and you have to use a very non-judgmental language, especially when you're talking to a female partner, a female patient, or a male patient, or a male partner, or female to female, or female to male. The general salient point when you're talking or trying to elicit the history is to have an empathy in your language. Your non-verbal communication, like your body language, your tone, your posture, plays a very important role here. Giving a signposting and gaining a consent before you start asking the direct question is very important. The opposite person should know what's coming in. To avoid any controversy and to avoid any kind of judgmental approach, always use gender neutral term. For example, instead of asking your wife or your boyfriend or your girlfriend, you should just name it as a partner. Always look out for the risk for the sexually transmitted disease, because risk-based screening even in an asymptomatic patient is important. So these salient points are not only important for your exam point of view, but also in your day-to-day practice when you're sitting in an OPD and when you're trying to elicit this kind of sexually transmitted disease, it becomes very, very important. Generally, you should start suspecting that you're dealing with a sexually transmitted disease uh, with certain specific complaints. So, when a male patient comes with, say, penile discharge or a dysuria or a scrotal pain or swelling, abdominal or pelvic pain or anal symptom, you should think that you are dealing with a sexually transmitted disease. Each complaint, you should get a bit more in detail. Like, for example, when you are talking about a penile discharge, you should be asking them about the color, the duration, the amount. If it's a dysuria, you should ask specifically whether it's just at rest or whether during passing urination. Um, Scrotal pain is a very important because even though you are thinking of sexually transmitted disease, but spontaneous torsion of testicles are also possible, and that becomes a kind of emergency. Anal symptoms, don't forget that unnatural sexual acts or actions, especially with the same-sex people, is possible, and hence you should always keep that thing at the back of the mind. Always evaluate in detail all the ulcers, all the rashes, all the warts in the urogenital and oral area. When it comes to the female symptoms, vaginal discharge, soreness, dysuria, pruritus, same ulcer, rash, wart, abdominal pelvic pain, postcoital bleeding or pain during intercourse, menstrual history, and contraceptive history are important. Beside this, general systemic symptoms like fever, malaise, night sweats, sore throat, myalgia, arthralgia, conjunctivitis, mouth ulcers, and sometimes different organ involvement included and not limited to liver, particularly the jaundice, should be evaluated for STDs. Now, once you know you are dealing with STDs, sexual history becomes a very, very important. You have to be very, very discreet. You have a lot of empathy, and you should always have that non-verbal communication posture. And you should nail this even in exam or in your real life. Then only the real history would come out. You shouldn't be hesitant in asking. Always make sure you ask about the sexual contact and partner's gender. Um, you should also ask about whether they are the same partner, they're casual or an unknown or professional sex workers, whether the use of any condoms were used, whether the number of partners you're talking about, natural, unnatural intercourses, all involvement of sexual industry or previous history of any STDs and HIV testing, and about the vaccinations. These you should ensure that when you take a sexual history, if you are covering all these points. A couple of sometimes background history gives clues, medications, allergy, use of recreational drugs, illicit drugs. Um, if none of them, at least having some tattoos or blood donation have been made. So during that time, they would have acquired these diseases, especially the hepatitis. Smoking alcohol doesn't necessarily mean that the person is got this more of a sexually transmitted, but this form an important starter for asking more deeper into the various habits, like are you smoking, do you take alcohol, do you take any recreational drugs, etc. Travel history sometimes becomes a very, very important. Particular notorious places you all know should be kept in mind, and support systems and expectations can also be gauged. Whether the person is alone, whether the person has a good supportive family, that would also gauge not only in terms of knowing the history, but also when you inform them and when you are treating the person, they might require some family or system support.